up and running.
Yeah.
Let's try one more time. I hit accept. It's not.
Let's see.
Patience to all. We just need another moment for our technical difficulties. Please be patient. Thank you so much. It says accept. I hit the button.
Yeah, it says, want me to try to join it again? Maybe I'll go out and come back.
Join it again. There we go. Unable to join, it says.
Okay, go live. Now I think it's working. Okay, we're there.
All right, let me lower my sound on this so when I get our. All right, can you hear me all right?
Yes, I can hear you just fine.
Testing. Wonderful. Thank you. Welcome. Let's see. Sherri Yvette Sawyerr, a pleasure to have you on today. We're both on our CNY Fertility Facebook and YouTube, and Dr. Rob Kiltz also. I added that, and our CNY Fertility Instagram. So welcome, Sherri. Thank you for joining us. We're going to talk about everything fertility. Is that right?
Yeah, that's right.
Well, awesome. Maybe you could tell us a little bit about yourself and how we're going to share ideas and be more creative.
Yeah. Do you hear an echo at all when I'm talking?
I don't.
Okay.
But wait.
Does.
Yep. Wait. One other thing. Hold on. Mic off.
No,
so my mic is off. But if you turn off and make sure that your phone device is muted, maybe.
Okay.
Sorry for our disruptions. Good morning. Good afternoon, good evening, wherever in the world you are.
Really quick at this. I think my AirPods are trying to do their own thing. So let me disconnect them from this, and I'll just leave it with the phone.
Yeah.
Me with the computer. Okay.
All the technical things that we do in this whole process.
Yeah, I think we're almost there.
People joining us. So, are you getting an echo still?
No echo on my end. Do you hear echo on your end? Okay.
All right.
Awesome.
All right. Well, again, welcome, Sherri Yvette Sawyerr. Pleasure to have you on today. And we're talking everything fertility. So thank you for joining us, and maybe tell us a little bit about yourself and what hopes in our conversation are today.
Yeah. Sorry, really quick. I think I got disconnected from the Instagram.
Go ahead. It's okay. This is live.
Figure it out. Okay.
This is all live. If you want to go ahead and this is all live. We're good. We're good.
You see me? Okay. Okay, good.
Not on Instagram.
Okay. Yeah, I don't know what happened, but
take a moment.
Let's see. Okay, let me just
come
back.
The beauty of live everything today is we're all doing this live, and that's the beauty of it. Sherri's coming back.
Okay. Yes. There we go. I think I requested.
I'm going to get you.
Okay, there we go.
All right. And I hit accept. It took a moment the last time. I don't know why I didn't do it right away. So just sometimes you have to there we go.
Okay. Let me get rid of this echo. Sorry, guys. We are figuring this out.
And I'm in California, in Southern California. Welcome.
Yeah, I'm in Orlando, Florida. I think we're good now.
I think we are very good. I just got to lower this one more tiny bit. Okay, don't leave me. I hope I'm not gonna lose everyone at the same time as I'm making my changes. Mike, okay, good. I think we're good. All right, we're gonna do our very best, even with a little bit of sound in the background. It's all good. So
yeah. Okay, I think we're good. I see people say they can hear us. But maybe there's an echo. If you guys, okay, somebody says they're hearing an echo. Let me mute. Okay. Is that better?
Yes, there we go. Yes, of course. That was it. Thank you. Woo.
Okay, awesome. Now we can get this started.
Yay, yay.
So hi, everyone.
Please.
Yes. Hi, everyone. My name is Sherri Yvette Sawyerr, and I live in Orlando, Florida with my husband, Talashi Sawyerr. I am a patient at CNY Fertility Clinic, and Dr. Kiltz is my reproductive endocrinologist. And we've been with CNY, I think our consultation was in September of last year. So coming up on a year soon. And, just really have loved the level of treatment and care that I received there. I switched clinics for my clinic in Orlando. And I think, as I was doing my research and trying to find a new clinic, I kept hearing about CNY and I was like, let me just look this up, join the Facebook page and, see what it's about. And I read so much about Dr. Kiltz and I would tune in on Sundays to your fireside chats. And I think what stood out the most to me was just how personable you were. I mean, you almost answered every question that people would ask. And I thought that to me, that goes like that level of sincerity and individuality just went such a long way. And, I kept telling my husband, we should watch these lives and check them out. And, for me, it was more about your approach to fertility treatment before we even talked about medication. So it was talking about the mind, body, and soul and nutrition and just keeping a positive mindset is what really stood out to me because we probably had 5 consultations total and no one had ever talked about that, before. And so that really stood out to me because that's what I felt like I was missing in the care that I was receiving before. Medications are pretty standard, I would say, throughout different clinics sometimes. But I really appreciated that. And I also appreciated just the individuality of treatment. When we talked about my previous treatment from other clinics and everything on our consultation, you were willing to try things that most, a lot of other, physicians would just not even think about. And, for me as a 42-year-old woman, when you get older, things slow down, your egg quality changes. I just really wanted the chance to give my body and, my eggs like the fair chance that they deserve, whether it worked or not. So yeah, that's where we are. We've been through 1 egg retrieval so far, 2 transfers. Unfortunately, they did not work. But that's how much I love you and CNY is because even when things don't work out, I still feel comfortable to keep going forward.
So what got you to share your story online into the social community?
Yeah. Well, originally it was just a way to document our journey so that Talashi and I could look back on it later. I've always been, if you ask any of my friends, like since I was younger, like I've always been the person to capture the moments. So going on trips together with friends, I'm always taking the pictures. I'm always, everyone's like, send me all your pictures and all that. So that's like a form of creativity for me is videography, photography. I'm not a professional, but like to use it for documenting like my personal life, me and Talashi's life, traveling, everything. There's always pictures involved. There's always video involved. And when we started embarking upon this journey, I was like, I want to capture it. I want to just look back and think about everything we've been through so that once we get our baby, we can look back and really reflect and have a great memory, even to share with them, one day about how we actually got here. The journey is always so interesting to me. It's not so much the end goal, it's where you start and the path that you have to go through to get there. So that's really why I started the channel. And then it kind of just grew into this community where people started reaching out to me who were, women of color, mostly around the same age as me and other CNY patients. And we've formed this like online tribe of support system to each other, like strangers that I now talk to almost every day that I met through an unfortunate circumstance, but there's always that light at the end of the tunnel where, I've gained some amazing friendships. I get people now that, will DM me and tell me about their story and say how much, our story inspired them as well. And I think, the more that we share these experiences or these difficult challenges, the more other people feel comfortable about either sharing their story or pursuing it, because a lot of people don't feel like infertility treatment or IVF is accessible. They think it's like, something for only rich people can have access to, and everyone else, like they can't have access to it. And so that was another thing that I was really passionate about, was breaking that silence of infertility and the stigma around it, especially in, the African American community, where, we don't talk a lot about these types of challenges, because, one thing that I feel like a lot of, women of color face is feeling like if they can't do anything else, they should be able to make a baby. And so not being able to do that naturally brings a lot of shame and stigma. And there's really no reason to have that. This infertility does not discriminate. It affects every socioeconomic class, every race. No one is free from it. So that was another reason. That's kind of what my initial reasons behind creating my channel started that way. And it kind of evolved into more advocacy, I would say.
And what do you think is the difference between our cultural, our color differences, and what can we do about them to make it better?
Yeah, well, I think conversations like this is an amazing start. Like I just think that it's the shame. I think that sometimes other cultures are more used to talking about certain topics. Whereas I know in the African American community, there are certain topics that are taboo, like, fertility treatment is one of them. A lot of people aren't talking about it. And even in me sharing my story, I had people that I've been close to since college that, came and told me, we conceived our child through IVF as well. And I'm like, we've been friends since college. And we talk about everything else, but we don't talk about those, really challenging, painful moments, together. I think there's always, at least in the African American community, it might be a sign of weakness, when you can't do something or you can't produce. And, we are faced with a lot of injustices as it is. So we always want to appear strong and that we have it all together, and that, we're fertile and we can, bear children and do all of these things. So I think that's why, but I think also, like, these kind of conversations with someone like you is so amazing to have. And I think it can help a lot of people to feel more comfortable, the same way I felt at ease when I first went to, like, your first fireside chat. I was like, wow, this doctor really gets it beyond just medication. You're talking about how to keep your mind and prepare your body, like, mentally, not just physically. So these conversations are really important. Asking the questions, people feeling like they have an ally, which I hope that they can find in me. If they don't always feel comfortable going, directly to a doctor or to a nurse or a clinical setting. But I think that these conversations are important to have and to continue, because just like I felt more comfortable, in coming to CNY, as it was like a good home for me to land, I think other people will feel that way too.
What about we talk about Eastern and Western and holistic approaches. Where does spirituality and faith and God and religion play in this, in the community that you're talking to, and how can we all in Western medicine be better at that?
Yeah, that is another thing I love about CNY. I mean, every procedure that I've had, there's been a prayer involved. There's always a God bless you before we leave. So happy to have you here. I think for me, like, faith, I'm a Christian. So faith is very important in my life. I feel like the nice thing about IVF and infertility treatment is it's a lot of science, but there's still a part of faith where you have to just let go of the control and give it to God or whoever your higher being is, because even though we're able to kind of help things along the way with treatment, you still have to have faith that it's going to work. And I think as practitioners, encouraging people, like, you are always doing a great job about, saying, whoever your higher power is, and, not forcing, like, religion on people, but also instilling faith in spirituality. I think there are a lot of people that are more spiritual than religious. And I get spiritual vibes from you a lot. I don't ever feel like I'm pressured about, a certain religion or anything like that. It's just, spirituality and what makes you feel good. And, you have to have that faith, because if you don't have that, then the science really doesn't matter. Because, when you fall on hard times, what I would say is, in this journey, there's a lot of ups and downs. And the only thing that is going to get you through that, maybe along with therapy and mindfulness and all of that, is your faith. Because you do have to pick up and keep going at some point. What happens when, that egg retrieval doesn't turn out the way that you wanted? Because that happened to me, where my egg retrieval got turned into an IUI at a different clinic. And I could have said to myself, my body is not capable. I'm too old. I can't do this. I can't produce any eggs. But my faith is what kept me going. And, having practitioners that talk about that at some level, I think helps and invites people. Because, I had my best egg retrieval results at CNY. Now, if I had quit at the failed IVF round, I would have never known that, So it's a combination of practitioners instilling that faith and spirituality and encouraging it and praying, because at the end of the day, it makes you guys seem just like everyday people as well, and we all want to feel like loved and accepted, even in medical practice. And I think that's where people have the hardest time and shy away from medicine, is when they don't feel like there's a personalized experience in it. And just that, God bless you, can I pray with you? That to me, like, speaks volumes. I've probably never had any other doctor's office that I've been to, offer that and, say that or anything like that to me. So I think the combination of that, is really important, because, as we know, IVF treatment is traumatizing. I think we all have a little bit of PTSD from it. I know that I do, but what helps is, that spirituality, that comfort, and that personalization.
So in your discussion with your community, what are the things that you talk about in order to sort of help bring them into that? Are there any sort of like 1, 2, 3 formula words, ideas, or thoughts that you bring into that to sort of bring them back into the community and the fold, and know that they're loved?
Yeah, we always say to each other, "I'm rooting for you." And those 3 words mean so much. When someone posts that they've had a failure, they've had a miscarriage, they've, are not able to afford it anymore, there's always someone that is encouraging somebody to keep going. I think it's the word, it's I'm rooting for you, and keep going, keep moving forward. Take your time to grieve, but just keep going, because no one understands failure in IVF like another person that's had failure in infertility treatment. And I think just that level of understanding is probably more meaningful to someone than maybe hearing it from like a family member or someone that doesn't understand it. Because there are some people that don't share anything with their family, and they only share it in these Facebook support groups. And I feel privileged. I feel like it's VIP being in there, because no one else is going to have that experience. And no, I mean, I'm talking to people that might have a transfer days after me. You know what I mean? No one understands the anxiety of like preparing for that and waiting for that, like somebody else who's about to go through it. And there's a friend of mine, she always says, when I'm like going through all these things, where I'm trying to like figure out 20 things I've met in a Facebook group, she's also going through IVF. And she always says, to me, when I'm kind of in that moment, instead of making the decision, and I think that's important too, is not always enforcing your advice on people, even when they ask for it, because it's such a sensitive moment that you're in when you're trying to figure out, like, I just had like, okay, after you just had a failed transfer, your emotions are shattered, but you're also trying to make a logical decision. And she always says to me, make the decision that's going to bring you the most peace. And I appreciate that so much. And it means so much more probably coming from someone who's also going through the IVF treatment, because she really understands, like, I'm not looking for a black and white answer here. I'm really just looking for emotional support. And I think we understand that the most amongst each other, because we're going through it together. But yeah, I'm rooting for you, and keep going. Those are the most encouraging words you can say to anyone. And this goes for anyone who's has a friend going through IVF treatment or infertility treatment and you don't know how to support them, just saying those words means so much to us. You don't even understand.
So lots of love and support and getting into the community. How do they find you, Sherri?
Yeah. So a lot of people find me on YouTube. I've had close friends that, maybe didn't know that we were going through treatment. They just would do a search on like, I don't know, like infertility or Black infertility journey or something. And then, a lot of people find me through searching for CNY because I talk a lot about our experience with CNY in my videos. So they find me there. I'm on YouTube. Sherri Yvette is my YouTube channel. And then they kind of trickle over into Instagram. They'll send me a DM, say, hey, I found your video, ask me whatever they want to ask. And we either will like keep connected and stay updating each other on the process. A lot of people I've met in the CNY Facebook groups, I'm probably in like 5 of those.
Wow.
CNY has a great outlet of Facebook groups. So that's usually how people find me.
And finding someone that's going through it, been through it, is willing to sort of open up their heart and share their pain and what they've gone through is so critical and important. When I started CNY Fertility in 1997, it was the standard approach. And I certainly know that the integration of East and West is so powerful. I'm getting some comments about the connection of mind, Marinus Pastrana, also talking about how women around the world in many cultures, if conception is not happening and pregnancy is not happening, delivering a beautiful baby is not happening, it could really be destructive to their personal lives, to the relationships. And what is it? There's so much going on in America with Roe v. Wade stuff, and I know that the differences based on people's culture, religions, and colors certainly are a major factor. How do we encourage more of those suffering to speak up and to do something in a positive way to open up the window to help more and more people in a positive way? Women, again, it seems to me like this RV Wade thing, whether you believe in abortion or not, is a step back in women's rights of all colors. But you're right, because of the financial stress of this, it's got to be huge for so many people.
Yeah, absolutely. I think, supporting each other, number one, women can be very unkind to each other. Let's just say that is across the board. We can be very competitive with each other. We can be very, catty with each other. And sometimes people showing, like themselves as being strong all the time and hard and harsh, they really have challenges going on with them. I think the more that we can, talk to one another and really just try to have empathy towards each other, like as a very foundational level, tactic is number one. But I think the people that are there to speak up and, it goes further than it's very important to vote, of course, so that, we can get some of these, things that are happening to us and these, Roe v. Wade getting overturned. That was a sad day across the board. I think every woman, maybe not every woman, but, it was a sad day across the board. I mean, even, my job, they kind of gave us the day to just like take off if we wanted. It was a sad day in history because of how far we've had to come to get Roe v. Wade even in the place that it's in. And I think it really shows that we need to come together more and think about, how this affects other things, because I think a lot of people are not thinking about the ripple effect of it. They're just thinking about abortion and everyone's like, oh, well, in infertility, we're trying to create life. Yeah, we are, but it still impacts us. And I think we have to come together more as organizations. I love resolve.org. They are amazing in the infertility space and speaking out against, things like this and being, proactive in getting like policy and things changed as it relates to infertility. The lighting of the Empire State Building back in National Infertility Awareness Week, they lit it orange. I mean, that brought like chills to my spine because, and everyone that I talked to that had been through like IVF a long time ago said the same thing. Because to be able to have that recognized, we have to support organizations like that are, being, pioneersmen in this space, because I feel like, IVF treatment has been around for a long time, but I feel like it's just now becoming more common to talk about it. And it's becoming more of a normal thing that people are doing, I would say. And I think it's organizations like Resolve. It's, physicians like you that have, amazing practices that welcome everyone in, so that we can support each other more and more people can have access. Like you said, I think access is key to people understanding, because if it doesn't affect you or you don't feel like you have, a way to get treatment or anything like that, then you're probably not going to really be that involved, So those are just some ideas and things that I would say. What about you? What would you
Well, I
offer?
think absolutely Resolve and getting involved, but writing your local and national representatives. But I think it's more than just writing a letter. I think you got to get out and you got to put the signs out, and you got to. It's really, Martin Luther King really got out there, Jr., and shared with the world in a way that people have to get out there and they have to show support and do whether it's a sit-in or you got to speak up in all this. I think that's where the voices can speak up much more today because of our ability. I call social media social medicine. We have to change that. Medicine is changing. What I found as a doctor is what I learned was wrong most of the time. And we treat people like a number. And even sometimes it seems like we treat people like a number because we're so busy. But ultimately, it's the simple things of looking in people's eyes and greeting them. And God bless to me is like the opening of the universe, or such a pleasure to meet you, which is something we did not really learn or appreciate. And I think part of it is because medicine has really been focused on money and not on mommies. And that's been our biggest challenge. And I know that I felt the hardship of all of it, but I've also kind of feel the sense of, if we don't speak up and don't learn and listen, because so many things I've learned to do, immunology, in Great East and West, and focusing on how faith matters, I've learned from my patients.
That's awesome.
And one of the challenges, I think, in doctors in general, any patient that shows up with a list of what they want to do, many of us doctors sort of run away or we kick them out.
Right.
And so I think the advocacy for that is so critical. The financial side of it, I don't know if I'm the lone one out here that is working to make it more accessible and affordable. What are your thoughts on how we can better advocate for that part of it? Because 85% of people in America can't afford IVF, at least.
I mean, I would love to highlight what CNY offers, because I mean, this is attractive to a lot of people. Like, a lot of people are sacrificing mortgages. They are going in super debt. Some people are working 10 jobs. Some people are, taking a job at Amazon just to get the benefits, and they're paying Cobra after that, after working 4 a night. The thing I love about CNY, and I wish more clinics would offer this, is that you guys offer in-house financing without a credit check. That goes such a long way in making things accessible for people, because a lot of people don't have insurance to be able to take care of it. And a lot of people can't sacrifice their homes, the food on their table, things like that, because the other thing is sometimes it takes a couple of times. So you're not talking about, I'm just spending this money one time. When our IUI round, failed, I mean, it was still the same cost. I mean, it's still, kind of the same cost in terms of medications and things that we had to buy. Blissfully, we have insurance to cover certain things, but most people don't have that. And I wish more clinics would consider, letting people finance things in-house, or, offering, more reduced pricing so that it could be more accessible to people. Because like the power of people is that, we have a good experience and we share, we bring more people to the clinic, and people just want to be where they feel like they're not going to be taken advantage of, because I think that's another thing, is trust. especially in like, the Black maternal health community. I think historically, we have been treated unfairly when it comes to medicine in general, particularly when you get ready to deliver a baby. There are people that are terrified to deliver a baby in a hospital because terrified to have a C-section because that's where a lot of, maternal deaths happen and things like that because of people not, and it's not even like during the procedure, it might be after because someone is not listening to you or taking you seriously when you say that I'm not feeling well, I feel like, maybe I still have an infection or, my head hurts, my blood pressure is high. That's what's happening. I think people, reaching out, like I think once the George Floyd, situation happened, there was this thing across the country in corporate America, because I work in corporate America, where now all these committees are being formed for diversity, inclusion, and companies were trying to find more ways to be inclusive and include more diverse people on boards and things. And I think the same thing needs to kind of happen in the medical community to a degree when it comes to making sure that there's more inclusivity and understanding that the financial barrier is huge when it comes to infertility. That's what keeps people away. That's what keeps people scared, not having the money or things like that. And I think that, that helps a lot. And I think CNY does a great job at making, treatment accessible. You guys need to make a board and just talk to all the other clinics in the world. And you guys are setting an amazing example of what all clinics should do,
One of the things I'd love to do is bring our community together on the client side, the patient side, for an advocacy group through CNY Fertility.
Yeah.
That would be really, I think, important to do, because I think the movement in our professional organization is not affordability, not access. We've limited the number of doctors that do what we do. What we've done at CNY, we're training practitioners and gynecologists to do this work. And for most of those practitioners, nurse practitioners and PA. So what we're really working to do is create a training program in embryology and nursing, MAs, LPNs, and everyone, but really working even on the side to maybe create a non-for-profit that's able to fund those that can't afford it. Because obviously the people that do the work can't do it without the revenue coming in. And so maybe there's a way to bring those that want to help advocate for those that can't afford it to allow us to continue to provide affordable services, because the pressures are great with rising costs and everything and on all sides. So my real drive, one is I love to work. I don't work. I although I'm in California on a vacation, not really, but I was in Colorado Springs, amazing group. We're going to be renovating the whole building. The team's amazing, but even supporting the team on all of us, because really it seems like there's these barriers between the medical profession and the patients, right? Our community. And how do we begin to sort of bring this all together? And that it sometimes seems like we're fighting each other. In all of this. It does. It does. And that's one thing I'm working to advocate for everyone on our team, is to look at every, I don't even like the term patient, by the way, because patients is a standard doctor-patient relationship. We're a community of healthcare providers on all of us, right? And that's why I love coaches and cheerleaders, and so much health and wellness is happening without doctors today.
Yeah, it's true. It's true. I mean, I feel like at this point, I could create my own protocol at this point, if I was able to write myself a prescription, I could do it, because of how much I've learned from the other clients. You know what I mean? Like, that's where I've learned the most is, in those Facebook groups that I'm in and talking about things. Like, for example, my FSH level was really high. And I was, worried because at the time my insurance that I had, if it was too high, they would deny me forever from coverage. And someone was like, you got to take wheatgrass shots, but don't do it while you're on stems. And my FSH dropped probably to like a 6 the next month, but I learned that in a Facebook group. I didn't learn that from a physician,
Well, and we created CNY Healing Arts to sort of integrate those things. And then I created the Fertile Grounds Cafe, which brought in some wheatgrass and some teas and herbal teas and things like that. I'm a big advocate of dietary changes.
Yeah.
And it's a hard thing for any of us to change our diets because of our cultures and our habits.
Yes.
What are your thoughts and maybe some questions that have come from your community on all of this?
Yeah, I mean, I think what the question that I get the most is, like, what do I even eat? I know that, keto is kind of king at CNY. And, I actually tried keto for a little while, and I liked it a lot. I mean, I felt great. I didn't feel like I was like being deprived of anything. I think the most important thing, especially culturally, as it relates to certain ailments that, mostly women of color have, like fibroids and things like that, it really, to me, boils down, what is the common denominator, when they talk about, majority of people with fibroids live in the South and they're mostly Black women. Well, it's what we're eating, it has a lot to do with what we're eating, because there are so many like similarities in the way people eat. And I always say, like, there's certain diseases that I feel like are not hereditary, but they're more generational curses that people can't break. My parents ate this way, so I'm going to eat this way. My parents prepared food like this, so I'm going to prepare food like this. And all of that is contributing to a lot of issues, PCOS, endometriosis, other things. It doesn't help those situations at all. And I know you talk a lot about inflammation, and a lot of the things that we love to eat are inflammatory, and so there has to be a way. I feel like it's really important, it's like, why would you start this, expensive science experiment, which might be the fertility treatment, and use dirty tools, and to me, that is like eating bad, feeding your body bad things. And so I think that we have to talk about nutrition like you do before we even get to the treatment, because what good is the treatment without, good nutrition?
It's an interesting idea that I've been sharing, and it was hard, but my theory is we're still the prisoners, the slaves, the soldiers, and the peasants, in a sense, because we're listening to the masters tell us to eat mush. And I know it seems a little hard to believe, because the term healthy diet has been ingrained in us, that we believe what they say is true. And inflammation, in my opinion, is all caused by plants and lack of eating fatty meat. That is like the one simplest thing that I've ever learned. And it is hard. And I know the reason I believe that the women of color are so susceptible to this is because genetically, again, they're not different genetically, but environmentally, there was very little carbohydrates in their ancient nutrition. Now, again, all of us essentially came from a meat-eating human, not a plant-eating human. And so to go completely carnivore, which is really, mine is carnivore. Keto is the key to the master class, which is meat. And how many men and women don't eat meat anymore? They think it's the worst thing ever. But the most expensive food is fatty meat, Wagyu A5, because it's held away from those that can't afford it for a reason, because it makes us masters. And there are ways to do carnivore keto that are less expensive also. But these are the game changers, and fibroids and endo, cancers, PCOS, all of them are all caused by a plant-based, low animal fat diet. But if you hear the word fat, we all do what? We like cringe and run away. We don't know. I don't want to be fat. But maybe that's the problem. We've been ingrained. I don't want to be fat so much that our brain think eating fat makes us fat, but eating animal fat makes you fertile. And
Yeah.
that's so important and powerful.
Hmm.
You know, and one of the stigmas in our fertility, in all of medicine, is not only color and
Hmm.
cultural discrimination, but size discrimination,
Oh,
which
yes.
I think
Yes.
is abominable and I don't
Hmm.
like.
Yeah. Yeah. I mean, I have friends that are trying to go through treatment and they can't because the clinic that they're going to, they say that they need to lose like 50 or 60 pounds first, and that means for someone who has challenges losing weight, like that could be a year from now. And you're talking about someone who's 43 or 42, we don't have a year, you know? Um,
Well,
and
and their
I
friends,
just, mhm.
go ahead, Sherry, I apologize. Go
No,
ahead.
no, no, that's okay. And it's unfair, because there are plenty of women who are overweight that are having healthy babies just fine, you know?
My opinion, and I'll bet $1 billion that being overweight doesn't cause any disease.
Right. I agree.
It's really so simple, but we have latched on to this. So the world of weight loss is so money making
Yes.
because we've convinced everyone that doing this thing that they need to be skinny, but no animal
Mhm.
tries to be skinny ever.
Right. That's true.
They work to be fat.
Yeah. It's so true.
But I tell
So
people,
true.
don't eat fake food. Don't, if you simply,
Yeah.
I'm the baby's guy, bacon, eggs, butter, beef, salt. That's it.
Yeah.
Which
Hmm.
seems like boring is the best way to a baby. And that's such an important thing for so many. And
Yeah.
how do we say, listen, you're perfect, your body, you're amazing, whatever the
Hmm.
size is? Why don't we
Yeah.
inspire all women to love themselves and help their
Yeah.
doctors? Like, are you discriminating against me for my size?
Right.
That's the
Yeah.
question. And
Hmm.
I know
That
even
is the question.
my anesthesiologist, oh, we can't do them. I'm saying, what?
Hmm.
I don't accept that. And I
Yeah.
think in medicine, we need to be more unaccepting and we have to
Yes.
say no. Would you
Hmm.
agree?
Yeah, I agree. And when I walk in CNY, what I appreciate is seeing women of all colors, all sizes, all shapes, and people feel welcome there. And I think that needs to go. Other practices need to work on that as well because it's not really fair. It's not fair. There are women that are overweight that don't need fertility treatment that are very fertile and can have babies with no problem. You know, so why discriminate? It's another way to exclude, and what we're trying to do is include.
Inclusive.
Yeah,
We have a donor egg program that we've been working on
yes,
for many years. It could always be
mhm,
better.
yeah,
Recruiting certain uh, races or color
mhm,
descriptions or whatever your description is. Sometimes it's hard to find that. How do we do
yeah.
better? What can we do?
I think it boils down to advocacy again. I think that a lot of women, period, don't know about becoming an egg donor. I remember when I was in college and I would see the ads on Craigslist. It just seemed so creepy, like $8,000 or whatever it was, for you to donate your eggs. But there was no like education as to like why it's beneficial to be an egg donor. And what I admire about CNY is, you guys have an egg donor program and you make it accessible and affordable because I think a lot of people think that are going through infertility treatment that it's too expensive. I'll never be able to afford it. Um, and I think it also boils down to women, I think, of all races, but especially women of color, are very untrusting of the medical system as it is. And so I think that has to be addressed first in terms of, working in the communities where, maybe there are more women of color and having webinars or having sessions at, like prominent places like Spelman College, which is my alma mater where I went to college, to talk about, things like becoming an egg donor and why it's important. Because there are a lot of women of color that do donate, but just maybe not, as much as you think, and people don't always talk about it because they might think it's weird or, well, how are you going to have a baby if you give all your eggs away and things like that. And that's just simply not true. There are plenty of egg donors out there that have kids of their own already, several kids, and they donate for different reasons. I mean, at my age, using a donor egg is definitely something that, we've had to consider. And, I remember like at first I was just kind of like, no, I would never do that, blah, blah, blah. And the more you don't have a baby, the more you realize like there are so many ways that you can become a parent. And that's what I would like to say to everyone is that there are so many ways now that you can become a parent. If you can get past genetics sometimes. And I always use this analogy. It's might sound weird, but I've had dogs all my life. And I am a huge like dog person. My one dog is they're both laying right here on the floor. And you cannot tell them that they weren't born from my womb. They think I am their mother. They follow me around. I have maternal instincts for them in the middle of the night if they're sick. And I've always loved kids, family kids, nieces, nephews. And so I've always kind of been used to loving something that was not genetically mine. And so egg donation, adoption, those are all options that we would explore if we had to, you know what I mean? And so I think it takes someone in terms of advocacy, maybe going into certain communities, certain places where, women of color feel safe, either to talk, a combination of talking to you and like someone like myself to encourage them how much they can bless someone else's life with one teeny little cell, whether that is an egg or a sperm. There's so many ways that people can give back in a way that maybe won't directly affect them, but becoming an egg donor, becoming a sperm donor, especially as, people of color, not only is it like financially rewarding, but you are granting someone a chance to have a child that would never be able to have a child otherwise. I mean, I'm in a couple of donor egg groups on Facebook, and the success stories that I read there, they're always preceded by like a tragedy almost, like I would have never had a chance to have a baby. I went through 15 rounds of, IVF, and then my first donor egg transfer, I'm pregnant with twins. You know what I mean? Like they bring tears to my eyes sometimes about how grateful people are for that.
I always say it's important to focus on what you want to be, a mom. And ultimately,
yes.
all of our DNA comes from the same place. It's all part of God's universe of creativity. And one of the things I always say, God's got this. And God's got this. No matter what is, if I always say God's got this, my stress and struggles, because I have them, believe it or not, I say God's got this, and I go right to my book to read and remind me of that. And one of the things that is a challenge is we pay $4,000 to a donor, not $8,000 or $10,000.
Right.
So maybe there's a little bit of competition in that because you can get more. One of the things that we talk about donating eggs, no one's donating eggs. We're buying their eggs.
Yeah,
so maybe how do we encourage people to really donate sperm, donate eggs, donate embryos, and even donate the part of carrying a baby for someone to really give and donate? How do we advocate and because all those women are suffering and then they're successful, the giving back part of it, how do we encourage that?
Yeah. I think it comes to like down to education. I mean, people don't know the aspects of all of this, and I think that's confusing. Becoming an egg donor, people feel like you're giving your eggs away for free, and it's not the case at all. I think the lingo has to change a little bit too, to kind of encourage it in a different way, because it's not all the way, it's not really true. Like you said, we're not giving eggs away for free, unless, a family member or something just wants to donate. But these women are being paid to do so, and they're doing it at their, own free will, simply to help another family. There are people, I've read profiles where people don't want to have kids. And so as a result, they donate their eggs. There's people that are going through gender reassignment, and before they do that, they want to donate their eggs so that someone else can benefit from it. That is a beautiful story to me. Just a beautiful story.
So really it's advocacy. It's marketing.
Yeah. It's marketing.
It's all marketing, because ultimately
it is.
We're not doing the job to share the options and opportunities for everyone, men, women, whatever the gender description is, whatever the size,
Yeah.
shape, age, wherever you're coming from, it's such an important thing to recognize. And
Yeah.
so how do we encourage those who have extra embryos to donate them, to build a family? And those that have extra eggs or want to give up, you do an IVF, we're really working on where it's shared egg cycles, cut the cost by sharing eggs. Other advocacy is, how do we help people get more affordable medications in all of this?
Yeah. And there are so many people that donate their medications. There are groups for people to be able to buy them, but there are so many people that will just say, hey, I have no use for these medications and I just want to help someone else. Because, the price tag on those medications, it will make you faint, it will make you pass out.
I'm working with Integrity, Metro, MDR, and many other pharmacies, and especially the actual the Merck and who makes Falsimenopur and Gonalep. Those are really three products that the companies. But we do a lot more natural cycles, no medications, more and more mini low dose protocols. But maybe there's a way to create a donation pool, even for medications and things like that. Again, that there may be more ways to do that. I know people are traveling around the world for fertility care. I still think probably is affordable or more affordable than the travels in so many cases.
I would agree. I agree. Because we looked into that too. We looked at IVF in Barbados, and actually CNY was more affordable than that once you added in the travel and everything,
Why is it, do you think, that human reproduction is really at the bottom of the barrel, in a sense, of our ability to focus and know what's really important in this world? What's your thoughts?
I think that what I say to people about times like this, there's always like monumental moments in history that really show you how people think of you, think of society. And the Roe v. Wade getting overturned was one of those moments for me. It really showed, there goes my dog, Blue. It really showed you how invaluable women are to society, or how they think invaluable women are. And that was, I think, what hurt so much, was that, here we are in 2022, and we are still having to fight for our right to say what we should and should not do with our bodies in that way. I mean, I've been watching a show on Netflix. It's called Call the Midwife, and it was probably set in the 40s. And in that show, they touch on a lot of issues, but one was illegal abortion. And of course, with what's going on now, it's right back there. I mean, talking the 40s, you know what I mean? And I just think that, lawmakers and the people that are in charge are not thinking about how this affects women, because it only affects women for the most part. I mean, physically, it affects women. And so it really shows you how much, as women now, we feel invalued about bringing life into this world, or stopping life, because you'll die if you don't. You know what I mean? Like, what about all of those cases where you're not going to live if you can't have something like that done? That's the part that hurts the most, is it's life or death. It's not about like whatever the reason is for people needing to have abortions or whatever, not to get too political, but like, what about the life or death situations too?
Well, to me, it's really amounting to days of slavery. And once again, a few people essentially make the decisions for the masses. And ultimately, it hurts those that could least afford it, if you think about it. And in some of the states where there's a lot more poverty, well, those with the resources get up and go to another place and get it done.
Yes.
But so many women of color are going to suffer more and more. And certainly it's not all just color, it's every human being is going to suffer.
Yeah.
And women seem
Absolutely.
to be losing ground in this, but I would say men are losing ground in it also, because
Yeah.
we need to be an advocate for the rights of women to make a decision for their own bodies, and
Yes.
not someone
Absolutely.
sitting in the Supreme Court of America that really doesn't know anything about the lives of
Yes.
those that are really doing the work of the world,
Yeah,
and
absolutely.
not are getting the support. And I'm here just to share some thoughts and ideas that we all need to look at each human being as a goddess and God, as a unique,
Yes.
beautiful individual that should have the same and equal rights as everyone else in this world. And did you want to anything other questions, Sherri, that you wanted to ask me or share that I didn't ask on your side?
Yeah, this has been awesome. I think, probably what a lot of people would want to know in my community, and the question I get the most is, how do you advocate for yourself? And I always give them the answer from the patient's point of view. But as a doctor, what would you recommend, and how would you recommend that, all women, not just women of color, advocate for themselves in this infertility journey? Because, it's a lot of medications, it's a lot of protocols, and it's a lot of this and a lot of that. What is your advice to maybe someone who's just getting started?
Well, get on the blogs and begin to listen and learn and watch, because what I've learned is that there's more information about medicine and health and wellness online than we had access in medical school. Trust me on that one. And no human being is any smarter than any other human being. We all have equal smarts, whether you go to college or not. It doesn't matter. Where you flunked out of high school or not, it doesn't matter. We're all human beings and capable. So you got to do the homework. And the homework is beginning to listen. And sometimes you don't understand it, but the more you listen to it, the more your brain begins to see it. We have many books out on Amazon, my keto carnivore stuff, my family building guide, the Fertile Feast, some cookbooks, everything. But that's a lot out there. Begin to listen, but talk to people like yourself and get some input to hear their story. And then others, what I love about, and I didn't get all to the questions today, I really apologize. But they're all very important, and I work diligently to get to those. I've been doing my 5 a.m., but now I'm in California. So my 5 a.m. is doing it. But it is really important to be your advocate. Write down your questions, write down your notes. The challenge is in medicine, we got 10 minutes or 20 minutes or half an hour. And so sometimes you have to reschedule. And those are important things to do. And if you're not getting the right answer from your practitioner, or they're taking your questions and throwing them out, not listening, find someone else, even if it's in the CNY fertility group. And I'm sort of I call myself the little crazy sometimes, but I can tell you this. What we've learned is that you must ask the questions. And if your practitioner is not listening to, or nurses or anyone anywhere, just say, well, can you please just take a few minutes with me, or schedule another time, or I really appreciate your time, I'm going somewhere else. So don't be afraid to say that, because you're not going to even some people on our side say, you know what, you're not giving me what I need. We all sort of match one way or another, and you got to feel the vibes. But sometimes I say, you must go through the hard things to get to the real beautiful things. Diamonds just sprout out of the seeds of the earth. A lot of hard work. And it is really amazing. Hard. Anyone can do easy. This is hard work. But I would say everyone is capable of hard work. I've been listening to this book by Mel Robbins called The 5-Second Rule. And it's 5,
I've
4,
heard of that.
2, 1, do it. And I've got this, and God's got this. And, you give it up to God. To me, that is really it. But you are the advocate. That's the amazing part to this. And too many doctors, here's, you got it. I'm going to label you with the disease. which is wrong, by the way.
Yes.
Then
Yeah.
I'm going to give you a drug or a dissection. And again, we do this also, but we truly, in my opinion, between the stress of the process and then the unnatural plant-based diet we're eating is the cause, but also we're over-exercising, we're overthinking it, we're overdoing it. A lot of it is slow it down, cool it down, cool it down.
Yeah.
That's really, really so critical in all of this.
Yeah. I had some really good advice the other day from a friend of mine who's a doula. And she said, you have to slow down in life to where a baby spirit feels welcome, that you have time for them, that there's going to be a place for them in your life. And that really stood out to me a lot, because I think we get so caught up in hustle and bustle, and really slowing down to take time to make space spiritually for this life that we want to create is very important. And that will really guide everything else that you do. You'll probably eat better, probably take more care of yourself, and all of those things. So I just think making space for this life that you want to create is so important.
Well, and cheerleading and coaching and a mentor, someone that's been through it, where you can cry and share your fears, your worries, regrets, but then you can get right to the true secret of life, that really God's got this in hand. So
yes, God's
Sherri,
got this. I love it.
God's got this. Where can they find you, Sherri?
Yes, so you can find me on Instagram. It's I am Sherri Yvette, and you can find me on YouTube. You just search for Sherri Yvette. You can watch our story there. But yeah, I'm on Instagram a lot. So if you want to connect and chat, chat there. I'm in a lot of the CNY Facebook groups. So make sure you check those out. Even I joined before I was even a CNY patient. So, and it just helped seal the deal that I just need to go here. So that's where you can find me.
We have so many people. I had one woman, she called me, said, Dr. Kiltz, I got pregnant on carnivore or keto or the giving it up and doing all these things. We hear the stories and they've never come to us, because we're all part of each other together in this beautiful community. So Sherri, God bless. Thank you so much for joining us today. And let's keep sharing it around. Take care.
Yes, please. Bye, Dr. Kiltz. Thank you.
Bye-bye.